Good morning, guys. It's Dr. Denney over at Four Paws at Fulshear Veterinary Clinic, and today Maddie and I are going to be chatting a little bit about diagnostic imaging, meaning like what kind of tools do we use to get imaging done on your dog or cat to help us decide what's going on and help us formulate a treatment plan.
Dr. Denney, how is diagnostic imaging used in diagnosing my dog?
So we use a couple different things at this practice. I'm going to go over a broad overview of things that can be used. We have two main things that we do here. So I'm going to start with those. So we have digital radiographs or x-rays. We do have like high definition x-rays, which is great because our detail is phenomenal. So x-rays can help us diagnose all kinds of conditions, from tumors to lung disease, to bladder stones, kidney stones, gallstones. They can even help us know, did the dog eat something that has gotten stuck, or a cat? Like, we can tell by the gas pattern in the intestines. We can look for diseases of the hips, like hip dysplasia, or if your dog's limping, we can help try to find a cause with the musculoskeletal systems. So there's a lot that x-rays can tell us. We also very frequently will send out for a radiology consult, which means that we have a boarded radiologist take a look at those x-rays as well and make sure that we don't miss anything. Because while we can tell obvious things, subtle changes can be something a little more difficult, and we want to make sure we don't miss anything. The second diagnostic tool that we have at this practice is we do a ton of ultrasound. Oh my Lord, do we use ultrasound. I've got multiple techs that help me with ultrasounds. I've got two of them that actually have gone and gotten like more studies done with ultrasounds. Like, I've sent them to get more training. Almost every single one of my techs is able to find the bladder and get urine samples. So we use ultrasound for so many things. It's a good tool for looking for inflammation. Sometimes we can tell if there's a blockage in the intestines. We can also see bladder stones, bladder cancer. Ultrasound can be a little bit more definitive on possible tumors in the abdomen than x-ray. X-ray can actually tell us, like, if there's a big growth, we can see that there's something occupying a space. But ultrasound's going to give us, like, okay, well, what kind of texture does this have? What organ is it coming off of? So there's just so many things the ultrasound can tell us. So those are the two main uses of diagnostic imaging that we use here at this practice. Now we're going to get into, okay, well, what are some other things we can use? If we have a patient that can't walk or is paralyzed, then that patient's going to get referred to one of the specialty hospitals and get either an MRI or a CT. Now, I know that's going to sound crazy, right? Like, isn't that just a human thing? And it's not. Dogs and cats can definitely get MRIs and CTs as well. The biggest difference between human medicine and veterinary medicine is that our patients, our furry patients, do need to be under sedation and anesthesia, because you can't tell a cat or dog to hold completely still. And when they go in the MRI tube, if you've ever had an MRI, I know I have, and the wall's like here in your face. So that's going to make an animal panic. So we do use a lot of sedation and anesthesia to perform those diagnostic imaging. There are other types that veterinary oncologists might use, where it's kind of like nuclear scintigraphy, where they can get like tumor cells to actually light up and fluoresce. So there's, that's another modality that can be used. There's fluoroscopy, endoscopy, where they put scopes down in the intestines or up the colon. Just like you do in humans. So basically any kind of form of imaging that humans can get, so can dogs and cats. Even cardiac echoes, so where you get an ultrasound on your chest looking at the hearts and making your measurements. We have that performed here. We have a sonographer that comes in and does those procedures for us, and a cardiologist that reads out the studies. But it's definitely like what is in human medicine is mirrored in veterinary medicine. Now, something that we probably need to chat a little bit about is when we're talking about these more advanced diagnostic testing, like an MRI or a CT, with human medicine, we can just pay our copay, or like whatever percentage we have to meet for our deductible. In dogs and cats, unless you have pet insurance, and even then, most of the time you're going to be responsible for putting that cost up front and then getting reimbursed on the back end by your pet insurance. Those tests can be a few thousand, so you do have to kind of have that in the back of your head. And it is one thing while I advocate either for pet insurance or your own health savings account that you can do personally, $50 a month into a savings account for Fluffy, and just forget about it. Just forget it's there. And because you never know. And well, if your dog or cat never has anything wrong with them, great, you have a little nest egg. But if they do, then it's not going to be a hit around tax time, or something to knock the wind out of your sails and you're just not prepared for it. So I do really advocate for either pet insurance or having like a little personal health savings account. So I hope this helped answer a lot of your questions about diagnostic imaging. I think, Maddie, do we have any others? Okay, great. Join us next. We're going to be talking about some frequently asked questions. And if you do have further questions, please feel free to give us a call. Thanks.